you're embarrassed and don't feel attractive because of hair loss, we have help coming up right here on Wednesday's show. See how hair replacement therapy can work for you right here. Father's Day is coming up this weekend. It's Sunday, which makes it appropriate for this month, June, to be Men's Healthcare Awareness Month. We welcome Dr. Meir Daller. He's a urologist who's here to help us. Welcome back to the Blend, Dr. Daller.
Thank you very much.
You will, in fact, be joining us here once a week.
Yes, sir.
And, in fact, I think your segment ought to be called, are you sitting down for this one? Dr. Daller Makes Sense out of anything and everything. Today we're talking about the prostate gland. It is something that men have. The ladies don't have to worry about it except for the men in their lives. What is the prostate gland and what does it do?
The prostate is a gland that sits underneath your bladder and it surrounds the urethra, the tube that you urinate from. The function of the prostate is to supply nutrients for sperm that come from your testicle to live outside of the body.
The prostate is about the size
of a walnut.
I've also heard it described, since we're here in the golfing capital of the universe, by the size of a golf ball?
That's correct.
Okay.
And the prostate does grow with age. As you get older, your prostate size does go larger.
So for all of us guys, it is inevitable that the prostate will be larger at the end of our lives than it is at the beginning of our lives.
That's absolutely true.
Okay. What are signs and symptoms of prostate cancer?
Bill, that's very important. Most cancer, when we want to catch it, when it's asymptomatic, in the curable stages. Prostate cancer overall does not have any signs or symptoms. And that's very important. We want to catch cancer in the curable stages.
All right. So if you have symptoms of prostate cancer, it's later. Is it too late?
Not always. Not always. Some men have symptoms of BPH, benign prostatic hyperplasia, when the prostate becomes enlarged, such as waking up at night or dribbling or weaker stream. And that does not mean you have prostate cancer, but it's just an enlarged prostate.
So if you don't have symptoms, what are the signs? How do you detect prostate cancer?
Okay. Prostate cancer detection, two things. One, PSA. The second one, digital rectal examination. PSA is a material that's being secreted by the prostate gland to the bloodstream. Three things can cause elevation in PSA. One, enlarged prostate.
Okay.
If you have a bigger factory, it will make more, whatever it's going to make.
Makes sense.
Two, inflammation or infection in your prostate.
All right.
And three, a little bit of prostate cancer can cause elevation in PSA.
So the PSA can be high, and two of the three reasons are not cancer.
Correct.
That's the blood test. The other is...
The other one is a prostate examination, digital rectal examination.
And
any doctor can do that. It's a gloved finger. You do a prostate examination, and you are going to feel, does it feel smooth or there are any nodule? Also, you're going to tell the size of the prostate.
It's a little uncomfortable, but it beats the alternative.
Correct.
Not knowing.
Yeah, I'm sorry. If the PSA is abnormal or the prostate examination is abnormal, what we need to do is we need to do a small office procedure. Is a prostate ultrasound and a biopsy. It's an office procedure. We put a small probe in the rectum. We take a few samples of the prostate and we send it to the pathologist, and he's going to tell us whether there's inflammation, enlargement, or a little bit of cancer.
Risk factors for prostate cancer are?
Okay, the first risk factor is age. As you get older, your risk increases. The second one is race. African Americans have 66% higher risk of developing prostate cancer. Having said that, blacks in Africa have one of the lowest risks of having prostate cancer. Okay,
interesting.
That's very interesting.
So it must be related to diet.
That's right. That's exactly. That leads me to nutrition. And we know from different studies, for example, Japanese, when they live in Japan, they have the lowest rate of prostate cancer. The moment they move to the U.S., their risk increases significantly.
Then the American society, while it is the land of the free and the home of the brave, because of our absence of exercise and our high-fat diet, those two subjects may be subjects for a future edition with you.
Absolutely.
Dr. Daller Makes Sense. I like that. Do you think that could be the name for your new segment?
I like that.
We look forward to having Dr. Meir Daller here once a week on Fox 4 Morning Blend.
Thank you for having me.
Thank you very much.
It's a pleasure. Thank you, sir.
Good health to you.
Thank you, sir.
During Men's Health Month, and to you out there as well. Coming up, speaking of health, we have a whole expo worth of it, filled with free healthcare services. Keep watching to find out. If you don't have health insurance, you want to hear what this is all about. But first, it's Doctor's Day. Monday morning, another doctor in the house. There he is, the plant doctor. When the Morning Blend returns, he has the prescription for how to make your vegetable garden grow abundantly and healthy and everything else. He's coming.